My name is Lai Meng-Chuan Lai English. I'm relatively new to Canada. I started living here from 2015. I work as a clinician scientist. That means I work part-time as a physician and part-time as academic in University of Toronto Department of Psychiatry in the Faculty of Medicine. Clinically, I work in the Center for Addiction and Mental Health and the Hospital for Sick Children as a child psychiatrist. Thank you for having me today. So I brought my coffee, which I have every day, actually 3 times a day, which was from Taiwan. So I actually brought coffee traveling back to Canada from Taiwan. My favorite food is actually miagao and 教导如. So it's hard to get those foods here in Canada. I spent the first 30 years in my life back in Taiwan. I studied there, I was born and raised there. I got my medical training there, and then I went to the UK for almost 7 years for research training prior to landing at Canada and working here. The slogan, think globally and act locally, is actually derived from my mentor in my training back in Taiwan, Dr. Wei Cun The lesson he taught me is really that we always have the fortune to learn other people's experiences, and especially in this very connected modern world, and everything around the globe is connected to each other. However, if we want to do something to benefit our society, then we need to act locally in our community. I think it's really about the interest into understanding both the human mind and the human brain. There are lots of arguments regarding are they related or how are they related, but back in my college time, I think I'm interested in both. Within the fields related to medicine, psychiatry is at the periphery because it's not ordinary internal medicine or surgery. It touches the most mysterious system in human, which is the nervous system plus the mind system. And that's actually what brought me into it. I think the most important thing I learned is that there are so many good people doing good work and so many talented people around the world. No matter I was in Taida or Cambridge or now in Toronto, I think these are all really stimulating environment that cultivates lots of creative thinkings and also people talking about doing things that can have impact to society immediately. This crosstalk between Taiwan and the different country and different culture is actually something pretty unique, because it actually comes up every year, right? So it's with different countries. I also like a lot in terms of the depth of the program, the conversations, the movies, the bands. I think that showcases the diversity. There's this Canadian spirit in all of these, which is the diversity, equity, inclusiveness. To be honest, these are not so easily cultivated unless you have a representation of these different groups in the society existing there. And that's what Taiwan is gaining the momentum to achieve a better world and better society with more awareness to equity, but it's still in the process there. There's still lots of lessons to learn. I think that's what I see different here is this mixture of the Taiwanese spirit and the Canadian ideologies. So in social psychology, there's a phenomenon called in-group bias. In human society, human groups, we all tend to make a distinction between the inner circle versus people who are outside the circle. And that could be in different scales and different layers. What it implies is that we all have a tendency to view people within our circle to be having more positive connotations versus people who are outside of our circle. So this is a universal phenomenon that we all have. So in-group bias can easily contribute to racism, to sexism, to heterosexism, to transphobia. It can contribute to all kinds of stereotypes that's related to categories of human. And the truth is that no one can be free from stereotypes. So this is natural, but one thing is natural doesn't mean it's justifiable, right? So the most important thing is that we can make a decision in terms of how we view or how we address our stereotypes. Most of the stereotypes can be explicit, but some of them can be really implicit. So I think that awareness of the possible stereotypes embedded in ourselves is so critical to address stereotypes related to racism and other issues that we're facing at the moment. Starting from knowing more, we know children, young children really don't have lots of biases. They may, but if they're exposed to a diverse environment, it's harder for them to actually to build a racism or other kind of stereotypes. So the global connectedness is actually helpful for people to start to overcome possible stereotypes. So for example, if I'm exposed to news media who's constantly broadcasting about a negative message about a specific race, although we're connected, the message itself is selected. And to be fair, the system actually promotes existing stereotypes. So in order to overcome that, I think we all need to have this media literacy. So we get to know facts, we get to know numbers, instead of only relying on stereotypes that has been repetitively broadcasted or even exaggerated through media. And then from knowing, it is important for us to have a conscious awareness of what might be going on in our mind, and then have a conscious decision of how we're going to deal with that. It's a very laborious process because we're so used to stereotypes. And stereotypes exist for a reason because they provide you with a quick categorization of people or things that actually turns some process into automatic, so your daily living will be more efficient. But that might be wrong. So we need to be aware of the stereotypes and constantly reminding ourselves that what I believed may not be right. And then go and look up into numbers and facts and then use that to challenge ourselves and challenge our own stereotypes if there are. So I think that motivation and decision making is also critical. Moving from Europe to Canada is an interesting contrast. Although, for example, in London, Paris, Amsterdam, it's still the old world. Even within such a metropolitan, diverse cities, there is still clear cultural, historical framework that lives here. So the first time I met with a few Canadian friends, they talked about when their grandparents moved here. It's interesting that sounds like lots of Canadian people actually embrace immigrants as part of their identity. There is a hidden consensus there that this is a place that people move to and then create something together with some shared goal. I think it's so important to be aware of that immigrant background as part of identity. And to be honest, apart from First Nations people, we're all immigrants. I think actually reminding us constantly of that actually makes it easier for the different group of people to peacefully co-create the future for the country. And I think that's what Canada is doing, and it is really a leader around the world who is demonstrating that this is possible. In the short 5 years living in Canada so far is that I think Canadian society really embraces diversity and treats it seriously rather than just treat it as a slogan. So I think Canada is setting an example and maybe a standard even for how the world should evolve. This is where, the lens looking at the data actually plays a very important role. I mean, maybe physical science has that sort of absolute existence in the object world. That's the truth. But when it comes to knowledge and how knowledge are being interpreted, it can differ depending on who's looking at the evidence and your whole knowledge system. My personal take is that I think this relates to, first, how much we're used to using it, and secondly, how much we're relying on modern evidence to inform the policy. And I personally think that this is also a good chance for the countries to learn from each other. I didn't grow up here, so it's hard to tell what mask means for Canadian or American people. I think there are a few different components. One is that Asian people are exposed to mask as a protection from very early on, so we get to know that. I do see, again, from the media, that the decision of having people wearing a mask relies on evidence. So the public health officials make their statements or recommendations based on the evidence. There are more and more research through the modern evidence-based medicine criteria showing that face covering or masking do have the effect of protecting the spread of the virus. The interesting thing is that even prior to these modern medicine evidence, what counts as the evidence that can be based for recommendation, I think that's where the differences lies in. So the Asian countries almost, with this folk knowledge that this works. So let's do it. So I think this is a complicated issue regarding folk culture in the different societies and how decision makings in terms of public policies are made, and to what extent they count a particular kind of information as evidence. At the very beginning, we do know that the healthcare sector is actually hit the most. The long-term care facilities are hit the most, and they are the one who's the most in need for PPEs. So if you actually create a panic in the society that everyone has to have face masking, but without that storage, then that's a big problem. I think it's really hard. What I can imagine is that if you are a public health authority, your decision will actually affect the whole society. I can only imagine how stressful they are going through different statements. And I think it's absolutely fine. It's actually encouraged to change your position, because that means that you are actually adapting to what's going on. I think it's better that people adapt and now promote the universal face masking for preventing the pandemic to further spread than to stick to the very original statement. We learn from mistakes, and that mistakes do not define us. It's what we choose to do that defines us, rather than what we did. It's a process of learning, and there's a huge individual variability here. From the more concrete parts, I think the ways Taiwan trying to handle the pandemic, containing it, and even not to the stage of mitigation, there are lots of components and pieces that can be learned by other societies around the world. On the other hand, you can almost view Taiwan as the society that's at the very, very early stages of the pandemic. Taiwan kind of freezes in that moment, so there's no massive exposure, there's no outbreaks, and there's no school closure. To be fair, these things can happen easily. So how other countries actually cope with the COVID impact in the long run actually showcases what Taiwan might be encountering and might be learning from in the foreseeable future. Yeah, I think there's already some ongoing project that people are collaborating, not only from the biomedical side of things, but also, for example, the long-term impact of the pandemic and the mitigation measures on people, especially young people who are in a way more vulnerable to, for example, physical distancing and the social isolation that people are experiencing. So Taiwanese young people are in a way lucky to not experiencing that so far. For some of the kids, it's actually hard to wear a mask because of sensory issues, because of some disability-related issues or other. But kids with similar conditions in Taiwan actually are mostly doing okay with that. So we should actually learn from the parents and the families of how they actually did it. And then that can inform what people can do in other countries. So I think there could be topic-specific opportunities for collaboration. And these are the ones that I can think of right now. So I'm Meng-Chuan Lai, Lai Meng-Chuan. I'm a child psychiatrist working in Center for Addiction and Mental Health in Toronto, and I'm also a academic working in University of Toronto. Okay, bye-bye.